Welcome to the Nutrition Hero Podcast with Dr. Brad Watts, making heroes in functional medicine and clinical nutrition. Now, here's Dr. Watts.
Welcome, ladies and gentlemen, to another episode of Nutrition Hero Podcast. I'm Dr. Brad Watts, your host. Thanks for tuning in today. I appreciate your attention. Your attention is more powerful than you know. Your attention as a functional medicine provider, your attention helps change the course of people's lives, and that's really cool. So people aren't paying for a result, they're paying for attention, and that's something that you need to remember, because over the years in treating patients, I've had an opportunity to participate in thousands and thousands of cases, and it's been a really great experience. And one of the things that I've found is it's not time that you need to charge for, it's attention. If you get the job done in 5 minutes, awesome. If it takes you an hour, that's fine. Just got to make sure that you find value in your attention, because that's really what it is. That's really what the engine is that's pulling this train in the right direction. So write it down, think about it, figure out how are you spending your attention, and see if you can do better at it every day, every week, every month. You'll find you'll end up in a position where your attention is helping people change their lives. All right. Hopefully all of you have enjoyed your 4th of July holiday. This episode will be coming out after the 4th of July, so everybody was safe and responsible and doing their thing. Gotta like that. Today, what I want to talk about is how to build a diary, or a diet diary rather, how to help your patients, how to point them in the right direction with food, and how to keep them accountable. And I might have spilled the beans there for you, but it's a diet diary. And research shows that when people actually write down their food, they are 3 times more likely to actually get results. And it's something about what people write down they want to be congruent with. Like if you have them write down their goals, which we talked about previously, they'll want to follow through on the things that they're making a commitment. They're wanting to follow through on what they're saying. What's even greater is that they want to follow through on what they write. I don't know if you've noticed this, but in our social media age, words are super cheap. Words are super cheap, but when somebody actually writes something that's going to last, they want to make sure that they honor that statement. And so your patients in a functional medicine clinic are no different. And it's really cool. I don't know where I learned this, but it's a really cool exercise to have your patients write stuff down. You don't do all the work for them. Let them do it as well. So as we look at creating food recommendations for people, there are a myriad of different types of diets out there that your patients can pick and choose from. I wrote an article, maybe it was last month, got published in a magazine that was describing this paleo style diet, and it's great and it's awesome and it works for a lot of people, but there's this band of people that you're going to see in clinical practice, and most of the time it's people that have dysglycemia issues, so maybe diabetes type 2, maybe a 1-5, or maybe even type 1 diabetes. But these people are trying to follow a paleo style diet and might not be helpful for them. And the reason being that their body fat is serving a purpose. So let's say somebody that has metabolic syndrome with type 2 diabetes, is their body fat there? Like, are they overweight as a side effect of the disease? Or are they overweight because their body is insulating something? Their body is protecting them from something. What is it? That's the question. So that's your job as a functional medicine provider to sort out. And so when somebody comes into the clinic and they say, "Hey, doctor, I would like to lose 35 pounds. Great. How come?" "Well, I want to look better." "Yeah, that doesn't do it for me." Right? "Well, I want to feel better." "Great. That doesn't do it for me either." "How come you really want to lose 35 pounds? So you got to get to the root issue. And really what it is at the very core is everybody's afraid of something when it comes to their health. And in this instance, metabolic syndrome, diabetes, they're being told by the media, magazines, online, etc., increased risk of heart attack and stroke, all the stuff that comes along with it. We have to figure out reality with these people, and that's where you want to get to before you agree to looking into the weight situation, right? So somebody wants to lose 35 pounds. It better be because they want to live longer. It better be because they have a 14-year-old kid at home they want to see graduate high school. It better be because they have a little girl they want to see married someday. It better be a story that actually means something to them. So whatever it is, have them write it down, and then you can proceed forward. All right, so when we talk about food, we have these paleo-style diets that everybody's trying or doing, etc. And for this person that has metabolic syndrome, it may not actually be beneficial for them. Like, we know that it's better to eat the protein and fat and the vegetables instead of the simple carbohydrates. We all know that. But what about actually losing weight? Is it beneficial? Any research paper that you read, is going to tell you that having a lower or a more optimal body weight is going to be more beneficial. The question that I have, though, is why is the body fat there in the first place? So we're going to build our programming, we're going to build our nutritional programming around our discovery process. And so as we build this nutritional programming, the discovery process happens, and you run your testing. You might look at blood chemistry, maybe some saliva, maybe an organic acids test. Wink, wink. Hopefully everybody's getting the hint here with the organic acids test. And over the last couple of episodes, I've mentioned it a few times. Oh my goodness. It is an indispensable tool. Okay? So anyway, maybe you're running these tests on them and you're trying to build and organize what kind of diet should this person be on. Well, if they have a toxicity load on their organic acids test, or maybe you ran a GPL toxicity test, if they have a toxicity load that is actually being insulated by body fat, you don't really want to get rid of the body fat right away. Otherwise, they become toxic, right? Otherwise, they become toxic. What you want to do is you want to make sure that you get rid of what the fat is protecting the person from. So this is key. So if somebody's gone through a ketogenic diet or a paleo-style diet, and they come to your office and they're like, "Doctor, I just can't do it. I've tried every diet known to man, and I lose 3 pounds and I gain 3 pounds over and over and over." Question in your head should be, what if they legitimately are trying? If they are legitimately putting themselves in the right direction here, there has to be something that is not allowing them to lose weight. Because remember, there are no medical mysteries when it comes to functional medicine. No medical mysteries. You have like detective cases to do, absolutely, but no medical mysteries. And so what we find is the root cause. And in this instance, I want you to think of this right away instead of wasting your time and the patient's time. Spend your attention on the root cause. What if the root cause is there's something in the body fat that the body needs to get rid of before you can see the fat go away, right? Like, think of a fat cell like a water balloon. If you put more water in the water balloon, the fat cell gets bigger, obviously. But what if I don't put water in there? What if I put a bunch of Skittles in there, right? It's going to get bigger as well. It's going to continue to get bigger. And so what do we have to do in order to make that water balloon calm down? Well, we got to get rid of the water, yes. But we also have to get rid of what the water is dissolving, and those are the Skittles. So let's say body fat cells have excess hormone. What if it's a fat-soluble toxicity? And if we get rid of the body fat around it, the thing that's insulating it, well, this person's going to be a toxic mess real quick. And so in this article that I wrote, what happens is you'll find in the research that many, many healthcare providers are just forcing these people into a lower calorie diet, pumping out the exercise and saying, lose weight. And sure, they'll lose weight. They lose 5 pounds, 10 pounds. They might lose all 35 pounds. But guess what? They feel like garbage because now their central nervous system's dealing with the toxicity that they're not prepared for. And so instead of putting the horse in front of the cart, we put the cart in front of the horse. And it's a mess. It's a mess. So here's my encouragement to you. Don't do that. Just look and make sure that we know what we're looking at. So if somebody shows up in your clinic and they say, "Hey, doctor, I have tried everything when it comes to weight loss," your first thought should be, "Wow, that's awesome, because I bet you $20 you have a fat-soluble toxicity." And you can sort it out. Blood chemistry will show us a little bit of that. GPL toxicity test will show us more of that. Organic acid test will show us more of that. GPL toxicity test, by the way, that's coming from the Great Plains Laboratory. I'm giving you all of my clinical pearls here, just so you know. So GPL toxicity test. This is a tool that not many people run. Typically, if you call the Great Plains Laboratory and you ask about a test, they'll let you run one on yourself for free so that you can experience it and then demonstrate it for your patients and say, yeah, I ran one of these on myself and look what I found. Okay? So pretty cool there. Anyway, let's see. Where are we going here? Oh, yes. When we talk about our diet diary situation, one of the things that I'm going to do before I recommend a food program for somebody is I want to know, what are they currently eating? And everybody says what they're currently eating, but it's hardly ever accurate. It's hardly ever accurate. It's hilarious. So you got to make sure that they document for 3 to 5 days exactly what they're eating, and you tell them, don't change anything. Don't change anything. Not at all. I want to know what it's like right now. I want to see what it's like right now in this moment. I want to know what you've been doing. And so people oftentimes will say, oh, it's so hard to write everything down. And they have this stuff called MyFitnessPal. It's an app that has food already programmed into it. You just got to find the food. If they're not, necessarily technology advanced, or they're not tech savvy, what I would do is tell them to just make a journal, write it down, notebook, bring the pages in with you next time, and we'll go from there. If they're not willing to do that, the easiest thing, have them take pictures on their cell phone. All right, everything you eat for the next 3 to 5 days has to be documented on your cell phone. You bring it in on your next visit, and I'm going to scroll through the pictures. We're going to see what we're looking at. And it doesn't get much easier than that, folks. So make sure that you're not letting them off the hook. They got to do some work on the front end for you, giving you the ability to assess, an accurate assessment, by the way, of their current nutritional status. So that's number one. Number two is you have two choices really when it comes to dietary programming. You can give them a pre-programmed diet, like a prepackaged diet. Like, here, you need to follow a Paleolithic diet, or you need to be on a ketogenic diet, or you need to be on a vegetarian diet, which I don't recommend, by the way. But the point is that you can recommend something that's already pre-programmed, so to speak. And that's one way of organizing your patient follow-through. It's one way. It's not the way that I would recommend, but it's one way. One of the things that I've found over the years in clinical practice is that the more information you have, the better for everybody in the long run, right? Like, a little bit about my story. So my first year in practice, like, wet behind the ears still in functional medicine. And I've only been a functional medicine provider my whole career. Like, I'm a chiropractor, a doctor of chiropractic, but I've never had a neck and back clinic. Never. And so when you talk about chiropractors that are phenomenal adjusters, don't look at me, right? I can do it. I enjoy it, but I'm more of like a drop table kind of guy, not a finesse kind of guy. And so when we look at functional medicine, though, that's where the finesse comes into play, because you spend a lot of attention on this. Your clinical acumen begins to grow, and your confidence begins to grow. And what's interesting is, in my first year of clinical practice, I had something that shook my confidence to the ground. Not many people have heard this from me specifically. A lot of people know about this, and a lot of people have their own opinions about it, but not a lot of people have heard me talk about it publicly. And so one of the things that happened in my first year of clinical practice is I was working in the largest functional medicine clinic in the United States. My wife and I were. And our first year in, got sued by over 30 people, many of whom I've never even met before. Imagine that. First year into practice, clinical practice. You get involved in a lawsuit with 30 people. I think it was like 34 or 35, something like that. It's wild. Really, what it does is it shakes your identity to the core. It did for me anyway. So here I am, a new grad, and you're like, oh, I went to school, got all these student loans. I moved with my new wife all the way out into the western states, and here we are practicing, and boom, you get slapped with a massive lawsuit. And in this instance, what was funny is that it wasn't really about anything we did. It was about what we said and about what we stood for. And it was medically driven. And, long story short, there's medical driven as far as the attack on the clinic and all of that kind of stuff. And because we were members of the clinic, like employees of the clinic, you just get wrapped up in it. And, you have a malpractice insurance policy, and that's really what the lawyers are looking at. And anyway, long story short, everything gets dismissed, right? Because it's all frivolous in the first place. But the point is that it really made me assess, is functional medicine a hill that I'm willing to fight for? Like, is this the hill that I'm willing to die on, so to speak? It's just like creating a battle image for you. And at some point, you're going to be forced to say yes or no in your career as well. And so this was my first year in clinical practice. Imagine this. Like, hey, welcome to the industry, Brad. Boom. There it is. And what it did is it really forced me to dig deep and say, is what I'm doing with the utmost integrity? And is what I'm doing actually helping people? Like, am I practicing something that I find value in, and are other people finding value in? And obviously you can tell after all of these years and thousands of patients later, here I am. Yes, I can say that unequivocally, that yes, we're providing value that nobody else in the landscape of healthcare is doing. Yes, there's value for your patients to experience here. And one of the ways that you build value is by testing. So I'm going to make a case for you here to not put people on pre-programmed diets. I'm going to make a case for you today to actually use the expensive tools in the marketplace to test and customize dietary recommendations. Okay? So here's why. If you ever find yourself in an unfortunate situation like I did just as a young doctor, and you are sitting in front of a room full of plaintiffs' lawyers, and you got 3 or 4 of them sitting across from you, and they're asking you questions that they're not really looking for truth, right? Because that's not what they care about. They're just looking to figure out how to hamstring you and tie you up in your words so that you end up having to eat your words and settle with the patient case just to make it go away, okay? Now, you don't want to do that, obviously, and the more testing you have, the better position you are in the long run. So here's one of the commitments that I made a long time ago. When it comes to food, I test. I'm never going to recommend a dietary program to somebody without looking at their chemistry first, right? Here's why. Is the American Diabetes Association right now, they recommend you eat a certain way if you have diabetes, etc. And this is just my opinion, but you got to ask, who are the biggest donors for the American Diabetes Association? They publish this information. You can look. Top 10 of pharmaceutical companies, right? So if I'm a pharmaceutical company and I have a medication that's telling somebody, and I'm saying, hey, you need this medication. Hey, American Diabetes Association, guess what we'll do? I'll give you $50 million this year if you make sure that your patients have to eat this way. And here's the research that backs it up. Okay, so this is just my opinion. Call me a little jaded if you like, but it's there. And so what happens is people are eating a certain dietary recommendation, and it's called the type 2 diabetes diet. This is the way you eat if you have diabetes. Think about that. This is the diabetes diet. We don't want diabetes. Why are we eating a diabetes diet? Right? Like the thing they did away with a couple of years ago, the food guide pyramid. Eat 6 to 11 servings of whole grains a day. That is the diabetes diet. You will end up with a sugar issue at some point, right? Dysglycemia is going to be your little buddy at some point if you're following that style of program. So one of the things that I found after going through all of the trials and the fires that I did as a young doctor is I found, you know what? Instead of having people follow a diabetes diet or an anti-inflammatory diet or a thyroid diet or a thyroid-friendly, whatever it is, right? Instead of having people do that, why don't we customize dietary recommendations to them based off chemistry? We'll call it the Bob diet, the Susan diet, the Brad diet, the Jim diet, whatever it is. And this way the dietary recommendations are dialed in specifically for that individual. How awesome is that? gives you an opportunity to be able to promote better function for them by giving them information that no other provider is going to give them. It's amazing. It's amazing. There are a myriad of tests out there that you can use that are going to run antibodies to food. You can measure IgG, IgA antibodies to food, and we're not looking at allergies, we're looking at sensitivities. And so I made a commitment a long time ago to run these panels on every single patient, because I know that if I'm ever sitting, God forbid, again, in front of a panel of plaintiffs' lawyers or in front of an attorney general, whoever it is that regulates your license, if you're ever sitting in front of them, you want to have as much information as possible so that any doctor, any provider can come in, look at that file, and they're going to say the same exact thing that you are. And so awesome when you walk in with a smile on your face because you know that like all the information's there. You'd have to be a fool not to be able to understand this. Okay? That is the key. That's the key. So what do? Customize food recommendations based off of patients' laboratory findings. I personally use Cyrex number 10 panel. Runs 180 different food sensitivities, IgG, IgA, and it gives us the ability to customize the diet. And it goes through common sensitivities, right? So it'll go through foods like vegetables, meats, grains. You get the nuts and seeds. You go through different herbs, spices, beverages. It's awesome. You even test coffee, right? That's a huge one, So what happens is you get the test done. They draw the vial of blood, and it's a little bit more expensive, right? But it's totally worth it, by the way. Totally worth it, both from a patient results standpoint and from a protection standpoint. Totally worth spending the money if you're serious about helping somebody, okay? And you even make it a qualification, right? I'm not taking your case unless you're willing to get the testing done. It's a qualification, because otherwise, how am I supposed to help you, right? Are we going to guess at what you should be eating? No way. What if your body's sensitive to cucumbers and you have no idea? What if your body's sensitive to broccoli and you're eating broccoli and chicken every day because you think that's what's going to make you lose weight? See what I'm saying? So we got to customize this specifically to the patient, and it allows us to be able to coach them in the right direction at a faster rate. And it's, black and white. Like patients, not you look at it and the patient goes, I can't have chicken. No, you can't have chicken. Right? Nope, you got to pick a new one. Your body is sensitive to chicken right now, so pick beef, okay? Or whatever it is with the vegetables. That's the one that gets me the most is the veggies. So it's phenomenal. It is just phenomenal when you see people, the lights go on and they go, oh, that's why I'm not losing weight. Right, because they have Hashimoto's, and every single time that you pour gas on the fire, meaning you eat food you're sensitive to, everything gets worse. So think about that in the context of how you're helping your patients. So what we do is I use the Cyrex 10 panel. There are other ones out in the marketplace right now, like LCAT testing. I think Genova has something along the lines of this as well. There's a smaller test. You don't have to do a Cyrex 10. There's a smaller one that does, I think, maybe 60 foods instead of 180. But what I find is that, for under $600, if you can get 180 foods tested, it's like bare minimum that is going to promote the right function because you're organizing. If they're sensitive to almonds, eat cashews. If they can't have an apple, then eat blueberries. Like the point is customize it for them and just take the guesswork out of it for yourself and for them. It's phenomenal. So my appeal to you today, right, is absolutely customize food recommendations for your patients based on chemistry. It's better for you in the long run when it comes to organizing follow-through, and it's better for you when it comes to having to defend the case if you ever had to do such a thing. So, all right. With that in mind, the reason I brought it up today is because there's a lot of doctors across the country that they guess on the food, and they send me laboratory work and they say, how come this patient's not progressing as fast as my other patients, right? You might see eosinophils elevated on blood chemistry. Maybe you'll see inflammatory markers elevated as well, like homocysteine, CRP, SED rates, etc. But they're asking the question, how come they're not getting better? And the point is hey, test their food. Dial it in for them, right? So when we look at these food panels, if you have an autoimmune patient, run it on every single one. Please run it on every single autoimmune patient you have. And I say that because you are going to change somebody's life if you can help show them that, hey, your body's not a fan of this, you should eat this instead. Hey, your body's not a fan of grain, you should be eating vegetables. Your body's not a fan of carrots, you should be eating cucumbers. It is phenomenal. You can even tell the difference between cooked and raw veggies on some of them. It is awesome. It's awesome. So anyway, what it does, and this is just my opinion, but what it's done for me in my clinics is that it has taken my ability to help patients and amplified my problem solving. Like, I get referrals from other functional medicine providers in my area now, and it's not a, oh, go to Dr. Watts, he's smarter than anybody else. It's not that at all, right? It's that they're not utilizing this testing. It's like almost like it's a secret. They're not using the secret testing that they should. And so patient comes to me and I go, oh, well, we'll just run some of the specialty tests that doctor also has access to. They're just not using it for some reason. And so set yourself apart by your diagnostic skill. Set yourself apart by the quality of the questions you're asking, right? Like, what food should you be eating? Instead of saying, hey, here's this book, just follow this. Right? Instead of saying, oh, you know what you should do? You should go on a paleo diet, or you should be a vegan, or you should be a vegetarian, whatever it is. Like, don't do that. Dial it in. Look. Okay? Now, side note, here's a side note for this. You run a Cyrex 10 panel and you see somebody that comes back with 100 food sensitivities, they're not likely dealing with 100 food sensitivities. It's called a polyreactive antibody screen. If they come back and they have a majority of them that are out of the laboratory range, the polyreactive antibody screen is a sign that possibly they have an immune stressor like an infection, or an unregulated immune stressor like maybe a yeast, maybe fungus, maybe a bacterial overgrowth, maybe just really horrible dysbiosis. And so I just want to throw that out there as a sign. Sometimes I'll get a question from somebody that'll send me a lab and be like, hey, you told me to do this test, and there's 115 food sensitivities on here. Are they seriously going to just drink water and eat rice? No, they're not. But that does give you the opportunity to look at the dysbiosis and you go, oh, maybe that's why they're not getting better. Okay? So this is a short webinar here today because I wanted to give you just a little tip. And remember, never settle. Don't settle. One of the claims to fame of the largest, I think, the largest clinic system in the world right now, Mayo Clinic, one of the claims to fame is that they have tests that nobody else has. They have machines, and they'll put you through a battery of test examinations that nobody else will because nobody else can, right? And what does the name Mayo Clinic mean to you, right? A game. It's the A team. I just say this because the Mayo Clinic's right in my neighborhood here. And the point is that they have the ability to look for things that not many other places do. So when there's a doctor that's stumped in the modern medical system right now, what do? Oh, you got to go to Mayo. Okay? Go look at go get looked at by a doctor at Mayo. Why? Is it because they're smarter? No, not a chance. Right? Not a chance. Why go to Mayo? Because they are going to look at you through a different lens. They're going to look at you, and if they can't find an answer, they're going to keep looking until they do. Be that in your community. Be that in your community. Use the specialty testing, and you're going to find so much value in it that your patients are going to start referring people to you as if you're the Mayo Clinic. Go see this guy. He finds everything out. Go see this lady because she will not stop until she gives you an answer. It's key. It is key. So a lot of people are trying to earn a living based on the follow-through. Here's a question for you. What if you were earning a living based on the diagnostic work? Like, what if you were charging a fee on the front end for the diagnostic, the look-through, so to speak, instead of giving away the part that you actually paid for in school, right, the diagnostic capabilities, instead of giving that away and just charging for your time, what if you started charging for your attention? All right. With that in mind, is where I'm going to leave you today. I hope you found value in this quick podcast with Nutrition Hero. I'm going to be back with an interview coming up on the next episode with a doctor that I highly respect, monstrously respect in the functional medicine space. And his name is Dr. Ruben Valdez. He's out of Miami, Florida. And so stay tuned for the next episode coming up. I'm going to give you some interview time with Ruben Valdez, and he is somebody that I think is changing the game on how we look at functional medicine, how we apply it to our patient base, and he's kind of a futuristic kind of guy as well. He has a foot in both the medical and chiropractic communities, and so I'm going to talk about where the industry is heading with him, and he'll give us some practice tips and that kind of stuff as well. So, all right, enjoy the rest of your day. Thank you for tuning into Nutrition Hero. I'm Dr. Brad Watts, and we'll see you next time.